My name is Nicholas.
And my name is Sage. We are Team Spira, based in Seattle, Washington. At 9 years old, I had the opportunity to visit India and was astounded by both the horrible pollution and the many impoverished people who lacked access to quality medical care. This led me to ask the question of what separates those in poverty suffering from medical issues from quality healthcare services.
Researching this gap led us to find that the ratio between people and government doctors in India currently lies at about 10,000 to 1, 10 times greater than what is recommended by the World Health Organization.
Furthermore, we found that one of the biggest and most common medical challenges that developing countries face is respiratory diseases. For instance, the leading respiratory disease, chronic obstructive pulmonary disease, kills more than 2.7 million people each year in developing countries alone. However, we found that respiratory diseases can be addressed if a proper and timely diagnosis is received.
As software developers specifically interested in the applications of artificial intelligence technology, we knew that with enough data we could build algorithms that could accurately detect patterns in respiratory disease data, mimicking the diagnosis process that doctors undergo. We were able to combine our existing knowledge of software and supplement it with mentorship and advice from pulmonary professionals.
Our solution is Spira, an ultra-low-cost device in which one can quickly and effectively receive a respiratory disease diagnosis. Spira's intention is not to replace doctors, but rather to help them do their job more quickly and effectively. Our goal was to make Spira extremely user-driven and frictionless to use.
Welcome to Spira. First, the user is prompted to select from over 100 languages. Next, the user is asked a series of questions to contextualize their symptoms. We reached out to medical professionals to make sure that our questions were relevant, readable, and result-oriented.
The next step is that of auscultation, in the form of a custom respiratory test that we have developed. Spira features a 3D printed digital stethoscope that, when prompted, should be placed on the right pectoral and records the user's breathing for 10 seconds. This data is then encrypted, stored locally, and passed through a convolutional neural network to predict one of 6 respiratory diseases.
To conclude, we are proud of what we've accomplished with Spira, but know that we've taken on a huge challenge of digitizing the medical industry.
In the future, we are eagerly looking forward to our device touching the lives of millions across the globe.